Hello, I wanted to share a story of a patient of mine, a 61-year-old female who were diagnosed with non-Hodgkin's lymphoma back in November of 2011. She had been under the care of a standard oncology establishment at best of its own, all through California, from USC and MD Anderson Cancer Center related institutions in Central California. She had an extensive double hit, what we call, technically speaking, of lymphoma that was diagnosed based on an extensive findings in her PET scan back in 2011 with massive retroperitoneal as well as pleural effusion and involvement of her chest. Back then, she was offered 8 rounds of R-CHOP, which is the standard treatment for lymphoma, and this treatment failed. In fact, she never went to remission, and her partial response was not sustained. She had a significant, fast, and quick recurrence with extensive disease in 2012 when she saw me. She sought obviously alternative therapies because she thought that we are doing alternative medicine, which is really not the fact. We do not provide alternative medicine. We provide scientific research-based treatments that are conventionally backed up by major scientific background. So regardless, we use natural compounds, and the IV epigenetic therapies that we use proved to be significantly effective in her case. When I saw her in July of 2012 for the first time, we did a molecular profiling extensively looking at the genes that were altered in her tumor, and we found 2 epi mutations that are significantly correlating with the lymphoma and non-Hodgkin's lymphomas, carcinogenesis and recurrence and metastasis, and these 2 genes were RB1 and TET2. These research are all new. Many of the oncologists are not even aware of these terminologies that I use. That's why I teach them. But I have published many literature in regards to the epimutations and how you can actually control them. She was lucky to see me, and I was lucky to be able to treat her very successfully. In a matter of just less than 6 months, she received the treatments, and we found a significant response. We combined it with rituximab and bendamustine as the very softer sort of a chemotherapy, and we had a significant response in her case. We were able to put her back actually to when she never had cancer, to complete remission. Her scans came back normal, and since then she's been my patient on a maintenance program which only is epigenetic therapies that we provide. She has not received any chemotherapies for the last 4 or 5 years, and she's still in remission. She comes to my clinic once a month and receives her IV therapy. Her last scan was performed a month ago, which did not show any residual disease after 6 years. This is very outstanding, and the reason I'm saying this is because if she would have chose to continue to the path she was going, meaning that she would have continued to receive more aggressive chemotherapies, and also she was offered radiation to her neck and then a stem cell transplant. It was not a matter of if, but a matter of when she would die, and she would have the recurrence of the disease. And this was discussed and disclosed to her by every oncologist she saw, every expert in the lymphoma that she saw, and they all came to the same conclusion that with the double hit lymphoma that she was dealing with, there was no actual curative treatment available for her, and she would die, and it would be just a matter of time when this will happen, and she would never be able to achieve remission. As we speak, she's in complete remission, and we're hoping to keep her in complete remission forever. Thank you.
Okay, hi, my name is Arlene, and I was first diagnosed with non-Hodgkin's lymphoma about 3.5, 4 years ago, and we didn't know anything about Dr.Nezami then, so I went to USC at first, and they worked with the oncologist in Bakersfield where we live, and I went through 8 rounds of chemo. Lost my hair and all the other wonderful things you go through with chemo, and I was clean after that. And so my sister-in-law, who had come up here to get some chelation treatments for thyroid, suggested that I come up to Dr. Nezami's office, just talk to him and see about doing infusions to boost my immune system to keep me healthy. And I waited a little bit. We finally decided to come up and speak to him, and I went ahead and did his initial treatment and blood work up to find out what I could be susceptible to. And I was able to do 3 or 4 months of treatments, but then my father got real sick, and so I wasn't able to come for about 3 months or more, and then I had to go back for an annual PET scan, and one little tiny lymph node came back inflamed. So we went back to USC and talked to the oncologist there, and I felt like a name and a number, and spoke with my oncologist in Bakersfield, and he said I would have to be getting even heavier doses of chemo, which I did not want to do. And then we went back and spoke with Dr. Nezami, and I got a really comfortable feeling from the very beginning, even from before when we had gone, that he understands it. He gets it. He has whatever the cancer chip is in his little brain, that he understands how it works, how it mutates, how it's different from person to person. He gets it. And so I went back to my oncologist after I'd seen Dr. Nezami, and he didn't want to hear anything about it because they think it's only their way or the highway. And it just didn't seem right. It just didn't sound right. And so we decided, with Dr. Nezami's help, to go for a chemo light and then also his treatment. So I would go and do the chemo and then immediately get one of his treatments. And it was very light doses of chemo for what I had, because he felt like that would work. And I never had any side effects, never had anything of anything. I could get up, go, do whatever I wanted to do. And since then, this has been about 3 years, I've been fine. I feel good. I feel great. I pretty much followed, and that's the key. You have to follow what he says. And what happens is people start to feeling so good, think, oh, I don't have to do that. I don't have to come back. And then it doesn't work. So you have to believe in him. And once you put your faith in him, everything else opens up. And he also believes in the spiritual side of treatment and feeding your spiritual self as well as what he does. I've loved coming up here. I consider the people here part of my family. We know their families. We talk about them, talk sports. It's much more comfortable. And what I noticed is every time I would come in here, people seem to get better. I did not see that with chemo. All I saw was death and dying and no hope. And here, I didn't feel that way because there was always hope. And I think having cancer, I think it's a lot of it's stress related. I think it's environment. I think it's a whole number of things, and that contribute to getting you to that place. And I think that that's one of the good things about here is everything. It's everything from top to bottom you get help with. And it's been a very positive experience. I'm still here. I'll come here as long as I can, as long as I'm able. And I would say to anybody who gets a diagnosis of cancer, come here first and do a consult with him, and then go from there. But understand that this man has a gift, and this is his gift. And he truly gets it. He takes every case personally. You're not a number, another patient, another insurance claim. And I think that's really, really important when you're sick. So that's my story.